without further ado, I'm going to turn it over to RxQuote.
In the long-running national healthcare debate, there's a little argument over one central issue, that our system needs to be reformed in order to lower the rising cost of healthcare and in order to provide better access to care to more individuals. Essentially, the government wants to ensure that all individuals are able to afford some sort of basic healthcare insurance coverage. At RxQuote.com, we plan to lessen this burden on individuals and small businesses by providing an electronic prescription insurance comparison tool for the under 65 population. Additionally, RxQuote will function as a one-stop shop for all of your healthcare insurance questions and needs. Now I'm going to walk you through RxQuote.com. So as you can see, you create a user login ID and password, E. At which time you're able to enter in the drugs you want. Sorry. As well as the quantity and frequency that you take these drugs. Then you begin a personalized search, at which time you can enter in some basic healthcare demographic information about yourself. And at this time, RxQuote will display the top 5 plans for you based off the prescriptions that you're taking. As you can see, annual deductibles as well as monthly premiums will be displayed for each of these plans. Let's say, for example, that you already have United Healthcare Insurance and you want to compare it to Humana. So you go to Humana, click on that, and it will compare both of these plans with the monthly cost for each one of the plans at both a retail pharmacy as well as a mail order pharmacy. It's at this time that if you want to sign up for Humana, that will provide you with a link to Humana's website, at which time you can sign up for it that day. It's at this point that RxQuote collects a commission from these insurance companies of what we approximate to be $15. This will serve as our primary revenue source at the beginning of RxQuote.com. As you can see, we provide other healthcare tools such as a pill identifier, a personalized healthcare calendar, to keep track of prescription refills as well as doctor visits, and a glossary of common healthcare terms, so you can learn more about your medications and disease states. So tonight, Peter Power, a second-year medical student, Mike Verbicki, a third-year law student, Piyush Gupta, a second-year MBA student, and Zach Sutton, a senior biology undergrad, will walk you, and myself, Andrew McLaughlin, a second-year pharmacy and MBA student, will walk you through RxQuote.com. We will show you some of the competitors as well as the market analysis for RxQuote, some of the legal IP position and regulations surrounding our company, as well as some of the funding and personnel needs, the barriers to entry within the healthcare industry, as well as I'll walk you through the future of RxQuote.com. As you can see from this slide, nearly $260 billion were spent on prescription medications last year in the United States. And this trend is only increasing as the number of prescriptions increased 72% from 1997 to 2007. And additionally, nearly 50 million people in the United States lack even some sort of basic healthcare insurance coverage. Earlier this year, Dr. Hassan of Rutgers University wrote that for every dollar spent on prescription medications in the United States, $4 to $7 were saved in other areas of healthcare. As you can see from these graphs, this trend is only increasing as the number of prescriptions purchased in the United States has only increased and the number of dollars spent has also increased. In conjunction with the fact that comprehensive healthcare insurance coverage can cost upwards of 4 times as much as standalone prescription coverage, and due to the fact that small businesses and individuals are often unable to afford this expensive comprehensive care, RxQuote is primarily targeting small businesses and individuals with our prescription insurance comparison tool to start out with, at least.
Thanks, Andrew. As Andrew just alluded to, our primary target market is small businesses. Initially, we'll focus on small business in Nebraska, then branch into neighboring states, and ultimately across the nation. Currently, most small businesses struggle to provide prescription or comprehensive health care insurance for all their employees, and many simply can't afford to do so. RxQuote provides these small businesses with the opportunity to purchase the most affordable, cost-effective, standalone prescription drug insurance, which translates into increased savings for these small businesses by reducing the overall amount that these companies have to spend on healthcare costs for their employees. Also, as Andrew mentioned, we're also going to target our service towards both uninsured individuals and self-insured individuals in the under 65 population. We have found a couple of close competitors, namely Destination RX, PrescriptionDrugInsurance.com, and MedImpact Healthcare Systems Incorporated. While all three of these companies provide a focus on providing consumers with a basic comparison of prescription drug insurance, only RxQuote allows the consumer to compare plans based on the actual prescription drugs that they take. We've also identified a number of potential competitors, Walgreens, one of the nation's largest drugstore companies, and WebMD, a major health information website. Currently, neither of these companies are in the business of comparing prescription drug coverage, but their name recognition, their resources, they could potentially enter the market. However, we believe that there are a number of significant shortcomings that would really limit their entry into this market, as I'll talk about on the next slide. So here's a chart comparing RxQuote to some of these other competitors. And again, as I said earlier, while the majority of these companies provide a tool for comparing prescription drug insurance, only RxQuote allows the consumer to compare plans based on the actual prescription drugs that they take. Also, as you'll note, PrescriptionDrugInsurance.com and Destination RX are primarily geared towards an over 65 population or individuals who are on Medicare Part D. RxQuote will be tapping into the under 65 population and small business, which none of these other companies have really tapped into. Also, RxQuote.com has the most number of value-added extra features that Andrew alluded to earlier. And also, as you'll note, Walgreens, one of their drawbacks, if they were to enter the market, is they wouldn't really be able to compare prices at other pharmacies or give out locations of other pharmacies, because then they would be competing with those pharmacies.
I'm going to briefly talk about the IP position. In doing an IP search, as Peter touched on, MedImpact and Destination RX are two sites that do have patent applications filed. However, those two companies, their patents focus more on consumers who already have plans, and they compare more drugs, brand name drugs, to generics. RxQuote will allow consumers to shop best plans out on the market. And this is just a sample patent drawing from MedImpact, just in their application. RxQuote.com will eventually have a similar one out there. Symbols and pictures associated with RxQuote.com will be filed with the United States Patent and Trademark Organization. Currently, RxQuote.com is already a registered LLC in the state of Nebraska, and RxQuote.com domain is already owned and registered under Andrew's name. Regulatory issues. RxQuote.com will need to become a licensed insurance broker in each state that RxQuote will provide service in. This will allow us to collect our insurance fees from the insurance companies participating in that state. Also, allowing the hiring of the employees and offering taxable services. One benefit is the information provided on RxQuote.com won't need to be vetted through the FDA, because the information we'll be providing will come direct from pharmaceutical companies, and it's already been approved by the FDA. And as far as HIPAA safeguards, any information on clients will be encrypted and hosted in a secure location, so we'll meet all HIPAA regulations.